Thrombocytopenia disorders. Thrombocytopenia is decreased platelet count, less than 150,000 per microliter. Leads to increased bleeding risk. Normal platelet function. Platelets produced in bone marrow. The precursor of platelets are megakaryocytes. Normal count, 150,000 microliter to 450,000 microliters. Functions. Form platelet plug. Help in clotting. Hemostasis. Maintain vessel integrity. What happens in thrombocytopenia? Decreased platelets leads to decreased clot formation, and increases bleeding tendency. Results in petechia, tiny red spots; purpura, larger spots; easy bruising; prolonged bleeding. Types of thrombocytopenia disorders. A. Decreased platelet production, bone marrow problem, fewer platelets produced. Causes: aplastic anemia, leukemia, chemotherapy or radiation, vitamin B12 or folate deficiency. B. Increased platelet destruction in blood vessels. 1. Immune causes. Immune thrombocytopenic purpura, ITP, systemic lupus erythematosus, drug-induced. Heparin, antibiotics. 2. Non-immune causes. 1. Disseminated intravascular coagulation, DIC. 2. Thrombotic thrombocytopenic purpura, TTP. 3. Hemolytic uremic syndrome, HUS. 3. Sequestration, splenic, enlarged spleen traps platelets, seen in liver disease, portal hypertension. ITP, immune thrombocytopenic purpura, is an autoimmune disorder, where the body destroys its own platelets, leading to low platelet count and bleeding. Pathophysiology, autoantibody formation. Because of any foreign body produces Ig antibodies against that antigen. These antigens starts platelet destruction. Antibody-coated platelets destroyed in spleen. Decreased platelet count, often less than 100,000, can be less than 20,000 in severe cases. Impaired clotting, increased bleeding tendency. 2. Disseminated intravascular coagulation, DIC. Disseminated intravascular coagulation is a life-threatening disorder. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2. Disseminated intravascular coagulation, DIC. Disseminated intravascular coagulation is a life-threatening disorder, where the body forms widespread clots in small vessels, and simultaneously develops severe bleeding, due to consumption of clotting factors. Key concept: clotting and bleeding at the same time. Excess clot formation blocks blood flow. Platelets and clotting factors get used up, result in uncontrolled bleeding. Pathophysiology, triggering event: severe illness activates coagulation system. Massive thrombin production leads to widespread clot formation. Microthrombi formation, small clots in vessels, causes organ ischemia. Consumption of platelets and clotting factors. Platelets decreased, fibrinogen decreased, activation of fibrinolysis, clots broken, and increases fibrin degradation products. D-dimer, body cannot clot, leads to severe hemorrhage. TTP, thrombotic thrombocytopenic purpura, is a life-threatening disorder, where small blood clots form throughout the body, leading to low platelets, anemia, and organ damage. Classic pentad, not always all present, but key features: thrombocytopenia, microangiopathic hemolytic anemia, MAHA, neurological symptoms, confusion, seizures, fever, renal dysfunction. Pathophysiology, large VWF multimers accumulate, sticky and attract platelets. Platelet aggregation, microthrombi form in small vessels. Platelet consumption leads to thrombocytopenia. RBC destruction, RBCs break while passing, causes hemolytic anemia, organ ischemia, brain and kidneys. 4. Hemolytic uremic syndrome, HUS. Hemolytic uremic syndrome is a serious disorder characterized by a classic triad. Hemolytic anemia, thrombocytopenia, acute kidney injury. Pathophysiology, trigger usually infection. Common cause: E. coli. Toxin damage endothelium. Toxin injures blood vessel lining, especially in kidneys. Microthrombi formation, platelets aggregate, leads to small clots in vessels. RBC destruction, RBCs get damaged while passing, causes hemolysis. Platelet consumption, platelets used up leads to thrombocytopenia. Kidney failure, Clots block renal vessels and leads to acute kidney injury. Clinical features. Bleeding signs. Petechia. Tiny red spots. Purpura. Purple patches. Easy bruising. Bleeding gums. Epistaxis. Nosebleeds. Heavy menstruation. Severe cases. Internal bleeding. Rare but dangerous. Investigations. Platelet count decreased. Peripheral smear. Bone marrow biopsy. Coagulation profile. PT, APTT. Tests for underlying cause. Management. General measures. Avoid trauma and injections. Stop offending drugs. Monitor platelet levels. Specific treatment. For ITP, corticosteroids, IV immunoglobulin, IVIG, splenectomy. Chronic cases. For DIC, treat underlying cause. Platelet transfusion. Fresh frozen plasma. FFP. For TTP, plasma exchange. Nursing management. Monitor for bleeding signs. Avoid IM injections. Use soft toothbrush. Apply pressure after venipuncture. Educate patient on injury prevention.